And the surge of new COVID patients now has Sacramento health officials pleading with people to not go to an ER unless you have a true emergency.
Dr. Olivia Casserier with Sacramento County Public Health Department is joining us now with the response from the county as local hospitals are reaching capacity. Good morning. Thanks for joining us.
Good morning. Thank you for having me.
It's good to have you. I know yesterday you said that you think COVID cases in the area have plateaued, and yet maybe that could be because of a backlog in cases. What's your gut feeling telling you this morning about that?
It's still the same. We're still monitoring. We still look like we are at a plateau, but we'll have to continue looking at the numbers.
Dr. Casserier, you know, we're hearing in some parts of the country 9 out of 10 people who are in a hospital with COVID right now are unvaccinated. How does that line up for this area? What do you know about our local hospitals?
In our hospitals, it's anywhere between 80 to 90% of the hospitalized patients are for COVID are not vaccinated.
Dr. Casserier, we know that there's a message out this morning about emergency room visits, and what is the Public Health Department in Sacramento County urging people not to do as far as ERs are concerned?
We continue to ask that the services for ambulance and emergency room be reserved only for true emergencies, because our hospitals are impacted at this time, and we really want to make sure that they're able to take care of people that really need to be in those places.
Sometimes we have to remind people what a true emergency is. So what kinds of things would be, in your opinion, legit to go to a hospital right now, and what kinds of things should you maybe go to something like an urgent care for?
People who are having a heart attack, people who are having difficulty breathing, those are the kinds of things that really need to go to an emergency room. But we have had people walk up to the emergency rooms and asking for a COVID test. There are a lot of other places where they can get that done. So we really want to make sure that people who need those kinds of services know where else that they can go.
And if this situation continues to get worse, doctor, I know there's been some talk about mass facilities once again, like we saw, more than a year ago. What's your feeling on that?
Then the mass facilities are not being considered at this time. Our hospitals are really coordinating to try and make sure that they're able to manage, and we're working with the state as well, and making sure that if one hospital is full, that the patients that are coming in can be taken to another hospital. So I think that the plan that they have is working. And of course, we continue to monitor, and of course, we're hoping that we're plateauing with the hospitalized numbers as well.
The numbers that you're offering up about the number of people who are unvaccinated who are ending up in the hospital with COVID are staggering. What is your message to people right now who have not yet gotten a vaccination?
Please get vaccinated. The Pfizer vaccine has full approval now. We still have pop-up clinics in all places throughout the county. There are a lot of different places where people can get vaccinated. That is our best protection against the COVID virus. And so we're really asking that you do it right now.
All right. Thank you, Dr. Olivia Casserier with Sacramento County Public Health. We appreciate your time this morning.
Thank you.